first. I am Betty Ann Nettleton. I'm one of 2 Elmore County representatives, and I will go ahead and call the meeting to order. Starting with a roll call for Boise County, I guess we have already been informed that Commissioner Sturm will be tuning in late, so I'll proceed to Ada County, starting with Dr. Young.
Jane Young from Ada County.
Dr. Epperly.
Ted Epperly from Ada County.
Commissioner Lacciondo.
Dinah Lacciondo, Ada County.
Valley County.
Commissioner Eld Hasbrook, Valley County.
Elmore County representative.
Megan Blanksma, Elmore County.
Okay, thank you, folks. Okay, let's proceed on with our action items, and I do want to express my gratitude for everybody joining us and your participation today in this important meeting. Under changes to the agenda, I'm going to defer to Director Duke. Are there any changes that we need to address under this item?
Madam Chair, no changes to the agenda for me.
Okay, thank you so much, Russ. Okay, proceeding on to new business. First item is we have the minutes of our May 15th board meeting. If they have been thoroughly read, and are there any corrections or additions to those minutes? Hearing none, I will call for a roll call vote for approval. Boise County is, of course, absent. Ada County, Dr. Young.
Jane Young, aye.
Dr. Epperly.
Ted Epperly, aye.
Commissioner Lacciondo.
Dinah Lacciondo, aye.
Okay, Valley County.
Commissioner Hasbrook, aye.
Elmore County.
Megan Blanksma, aye.
Okay, thank you. Hearing no other objections to the minutes as are approved for our May 15th board meeting. And proceeding on, we will have a vote concerning our July 7th board meeting minutes. Are there any corrections, additions to those minutes? Hearing none, I will proceed with a motion for approval, starting with Ada County. Dr. Young.
Jane Young, aye.
Dr. Epperly.
Ted Epperly, aye.
Commissioner Lacciondo.
Dinah Lacciondo, aye.
Okay, and Elmore County? Elmore County?
Megan Blanksma, aye.
Okay, thank you so much. Okay, motion for approval of the minutes of our July 7th meeting is those minutes are approved. We will proceed on to discussion on face coverings as a means to reduce coronavirus transmission. Director Duke, do you want to lead that discussion and introduction of guests?
Yeah, sure. Thanks, Madam Chair. I have invited Dr. Nemerson from St. Alphonsus to speak about face coverings. That is the subject for the board's consideration a little later on in the agenda. And I wanted the board and the public to hear from somebody who is well researched on the subject and can describe what their purpose is and how effective they are at reducing the spread of coronavirus, the cause of COVID-19. So I will turn over the time to Dr. Nemerson, and then when he finishes, if you all have questions, he'll be available to answer those.
So thank you. I hope everybody can hear me clearly. And I appreciate being invited to participate in this important meeting and discussion regarding face coverings. To begin with, I'll call your attention to the fact that there was a news conference held earlier today featuring leaders from all the primary health systems throughout the state of Idaho, during which a great deal of data was presented around current COVID incidents in our respective communities, the exponential growth rate that we're now experiencing, the clinical scientific fact of ongoing expected growth of coronavirus, the healthcare practices, and by that I mean not only our health systems, but in addition, our large group and independent small medical practices throughout the state experience with increasing numbers of coronavirus patients coming and requiring medical attention, and the fact that that volume is impacting our ability to deliver regular or routine as well as urgent and emergent medical care. So I'd be happy to go into that detail, but just to be concise and respect the time of this group and the audience, I just want to provide some very basic statistics. As recently as 4 weeks ago, throughout the state of Idaho, the incidence of coronavirus was flat, meaning there was essentially no growth, no decay, which had been experienced previously, but no growth in coronavirus. And now we're seeing what is called the R0, or the reproduction rate of the virus, that is exceeding 1, which is a flat rate, and spiking at times in the past couple of weeks to a growth rate in excess of 3. And it varies from day to day, and it has to do with the turnaround time of testing and other factors. Bottom line is that this means that the virus in people in all of our communities throughout the state is increasing at a multiplicative or exponential rate. So that's the first thing to know. The second thing is that, as I referenced, all of our healthcare systems are experiencing a growth rate now in terms of hospital patient volume that current estimates, which are fairly accurate and consistent in multiple models, are showing a doubling of COVID hospital volume every 2 to 4 weeks. And probably the most accurate estimates that we've seen suggest a doubling closer to every 2 weeks now. And the more it spreads, the more it's going to grow and spread quickly. So that's the second thing. The third thing is that health systems, well, we have communicated very clearly that we have sufficient capacity to care for the needs of the community. The fact is that we are now having to balance that demand with the demands of non-COVID care. And what that means is patients who require urgent surgeries are having to wait, and patients who just need to see a doctor for things like diabetes, high blood pressure, etc., are also finding that they are having to wait in order to get the care that they need. And we know, both based on national studies and now emerging more recent data in Idaho, that this phenomenon is compromising patients. So that's the environment in which we live now. We know we'll continue to progress without change in the behavior, if you will, and the socialization of people in our communities. So without any further intervention, the problem is going to continue to grow and compromise the well-being of our communities. I haven't even touched on the testing problem, which because of the increase in COVID, the demand for testing has skyrocketed. In my own health system specifically, it's gone up by a factor of about 20 to 40 times the demand in the past 2 months. And as a result, we've had to restrict testing to patients who have medical necessity for knowing their COVID diagnosis. The bottom line, that compromises our ability to support industries that want to return back to business, schools that want to be able to have students return, and a variety of other needs that the community has. Therefore, the obvious question is, what can we do together as a community to link hands to help one another to get things back under control? And the answer to that is threefold. Number one, face coverings. The science behind face coverings is very clear. The benefit was first demonstrated in China, and everyone knows about the origins of the epidemic in China, and has been replicated in multiple countries, including Singapore and South Korea. And now the data is very clear here in the United States as well, that face coverings reduce the risk of transmission of coronavirus from one person to another independently by a factor of many percent. And the most recent meta-analysis that I reviewed, meta-analysis being a combination of multiple studies, suggests that the risk of transmission from one person to another, if both are wearing masks, can be reduced by a factor of as high as 85%. That's 85%. Combine that with physical distancing, which is the second factor that we require. And obviously, we've all heard about the figure of 6 foot distance from one another. The fact of the matter is that optimal social distancing is the further the better. 6 feet is an absolute minimum. Combined with being in a well-ventilated area, preferably outdoors, and avoiding any kind of group collaboration, so being within family where you know who you're exposed to, obviously fine. Being with others who you don't know where they've been, and also they have a distinct possibility of carrying the virus in a hidden way, meaning that they may not be demonstrating symptoms at that moment in time. Being separated from them is a component of optimal social or physical distancing. And then the last piece to success is excuse me, I lost my train of thought.
Hand washing.
Yes. Hand washing, thank you.
You're welcome.
Thank you very much. And hand washing and disinfection. And so hand washing meaning literally soap and water. This virus is very vulnerable to soap. It is also very vulnerable to a number of surface disinfectants, so frequent hand washing is critical. And those three components are the triad by which we can literally reduce the risk of transmission from one person to another to almost zero. And the last thing I would add is, in the context of face coverings, which are being discussed here specifically, there's been much conversation and media attention around people who cannot wear face coverings. I will tell you that it is a very, very rare circumstance in which a patient cannot wear a face covering. There are certain medical conditions, the most significant being severe. And by severe, I mean so debilitating that it basically keeps a person at home, respiratory disease or cardiac disease. Those would be the principal circumstances under which someone would not be able to wear a mask. And our physicians and providers throughout our state are in an excellent position to be able to make that clinical assessment and determine whether someone should be granted that rare exception of not requiring a mask. So that's, I think, in large part the science behind this. I'd be happy to address other questions.
Thank you, Dr.
Madam
Emerson.
Chair.
The floor is open for discussion.
Madam Chair, this is Commissioner Lachiondo. Dr. Nemerson, I have a question, if that's okay, Madam Chair.
Yes, go ahead, Diana.
So one of the things that I'm, hearing from constituents and certainly seeing sort of out in the world is, as this public health crisis has evolved, the recommendations have changed. And, I'm learning more and more that that is a key factor of public health. When we learn new information, we have to fold it in. And I think there's a lot of confusion about what some of the initial recommendations were, perhaps back in March when we lacked access to PPE versus now. And I'll just note from our own experience here at Ada County, we were working really hard to try and secure enough PPE for our paramedics, for our jail deputies. But that was at the time when the CDC was recommending that people didn't wear face coverings. Could you speak to that, certainly for the board, but also for the public?
Absolutely. And you are entirely correct. The knowledge about this virus has been evolving, and while it seems like it's been a long time, the fact is we've really only been experiencing this pandemic since mid-March, and here we are at the beginning of July. So it's been a handful of months. During that time, and I don't want to confuse matters, so I'll keep it short. At the beginning of the epidemic, one, there was great concern about the availability of any kind of protective equipment, and that includes face coverings, face masks, as well as eye protection, as well as gowns and gloves. And it was very apparent based on the international experience that we needed to cover our healthcare workers so that they wouldn't acquire coronavirus from their patients that were being seen. That hasn't entirely changed, but what has changed is the availability of personal protective equipment, particularly masks, has become much more readily available. And in fact, we find ourselves in this part of the journey where the demand has increased for healthcare reasons as well as industry and community reasons, and yet we're still able to keep up, meaning manufacturers are still able to keep up with the pace. So that was one of the things about trying to avoid unnecessary mask use in the community if it was not going to be helpful and allow healthcare providers to be protected. Second thing was we didn't appreciate at the beginning of this epidemic that healthcare face coverings, that face coverings simply made of cloth would provide sufficient source protection or enclosure of the nose and face to keep the droplets that carry the virus from affecting or infecting somebody else. And so there were some serious questions around whether masks would be a benefit if they weren't medical masks. And there were serious questions around how many people really needed to be masked to be protective. And what we've learned is, indeed, cloth face coverings are of benefit. And we've also learned that through population study and so forth, that the more people whose faces are covered out in the world, the more effective we are at containing viral spread.
Thank you, Dr.
Madam
Nemerson.
Chair?
Yes, Dr. Young, go ahead.
Dr. Nemerson, I've got a couple questions. One is when you're talking about the 85% change by wearing a mask, does that include the cloth masks?
It does.
And my second question is comparing the mask to the face shield.
So one of the things I really want to emphasize is, as I talked about the triad of protective measures, each one is additive to the others. And so the face shield, which we haven't discussed because in a lot of ways it's just not practical in the public, is an additional benefit that we, within the inpatient or hospital healthcare setting, we are not only encouraging, but we are mandating for the care of COVID patients, patients that are considered to be risky for carrying the COVID virus. And so the face shield, which covers optimally from the forehead to below the chin, complements the face covering or face mask, which then also complements the physical distance and the hand hygiene. So all of those things are important. No one of them is a substitute for the other, but the thing that appears to be the most effective tool, the single most effective tool outside of the hospital environment is the face covering.
Thank you.
Sure.
Madam Chair, this is Ted Epperly.
Yes, Dr. Epperly, go ahead.
Thank you, Dr. Nemerson, for your comments. They're very helpful. Could you please comment, since we're at a critical phase here in regards to the triad of protecting the public with face covering, social distancing, and hand washing, what the data might show in regards to all age groups, especially for children over the age of 5 as well, as the state contemplates reopening schools from a public health perspective now, not from an educational perspective, not from a school board decision, but from a public health perspective. Could you opine on face coverings for all people over the age of 5?
Sure. So what we know about children specifically is that there's a developmental age at which children are less likely to be able to tolerate wearing a face mask, and that age appears to be under the age of 2. In other words, it's pretty impractical for most children under the age of 2 to be wearing a face mask. Not that it necessarily causes harm. It really should not, as long as they're properly applied. Obviously, we worry about babies sticking in their mouth. But be that under the age of 2, we would not recommend using a face mask for developmental reasons. Over the age of 2, then we rely on parents and others to judge whether or not their child is at risk of putting a face mask on. And over the age of 4, in otherwise normal children, those who are not developmentally needed or do not have a severe behavioral or psychological problem, there's essentially no reason that they should not be able to wear a mask with proper coaching, encouragement, making a game out of it. And if you look on YouTube and other places, there's all kinds of videos out there now about how to support your child, how to get them to wear a face mask. And also at that age, developmentally, by the time they reach kindergarten particularly, they're able to understand that it's helpful to them and it's helpful to their family, and they take to it. And I've seen that myself personally. And I think the other thing you're asking me about, and I'll stop just to validate, is about the risk of transmission from a child to another child and the risk of transmission from a child to an adult in a school type setting. Is that something you want me to comment on?
Yes, I was going to follow up with that question exactly. So thank you.
You're welcome. So the people who are at the highest risk for transmitting the virus are basically adolescents and older. So that would be approximately the age of 14 to, much, much older people, adults of any age. The reason that they're thought to be the highest risk or have the highest viral load, which they expectorate, cough, spit out, whatever you want to call it, breathe out. The reason they're at the highest risk is, 1, they're bigger human beings. 2, they project louder and further when they speak and when they cough and when they sneeze. And 3, the nature of the infection in people who are adolescents and older is such that the virus is more readily able to adhere and colonize the breathing tract, which means your nose all the way down into your lungs, and also your GI tract to a degree, it's able to attach to those areas much more effectively than it is in younger children. And as a result, you know, just to be sort of a little bit humorous about this, is teenagers are, you know, the petri dish of coronavirus, as are adults. Younger children, between the ages particularly of about 8 years old to 14 years old or so, in that range, they're less likely to have as aggressive colonization of the virus, and so they're less likely to transmit. And then finally, the youngest of children are the ones that seem to be the least affected, the least colonized, and the least likely to transmit. For both the physical reasons, they're not loud, they're not breathing hard, they're small human beings, and also because the virus doesn't take to them, if you will, doesn't plant itself in them to the same degree that it does older people. So in a school-like setting, the things that we'd be looking for, and please don't take this as a school opening recommendation, but the things that we would be looking for to create a safe environment in the school is all those things that I mentioned previously, that triad of coverings, hand washing, distancing, combined with a classroom that has very good ventilation and high ceilings to minimize the containment of virus, which is almost certainly going to be brought in by these children. And the last thing to comment on, so I've commented on a bit about infection and risks, basically say high schools, in the same building, a group of teenagers, i.e. high school age kids, create a higher risk to their teacher than a group of kindergartners who are well behaved would. You also need to realize that children, and the younger you go, likely are much more likely to have mild to absent symptoms, meaning that they're asymptomatic or they do not have symptoms despite the fact that they're colonized with the virus. And therefore, children of all ages who are not presenting with symptoms are likely to expose adults at a much greater and riskier extent because of the fact that we never noticed that they're carrying the virus. We had no clue, literally. And as a percentage, between adults and children, we know that up to a third of people can be carrying the virus without symptoms. Those that are carrying the virus, a third of the people who are carrying the virus can have no symptoms manifest. And the younger you are, the higher the percentage, the older you are, the lower the percentage. I hope that's helpful.
It is. Thank you very much.
Madam Chair, this is Commissioner Hasbrook.
Yes, go ahead, Elt.
So that's a pretty profound statement when you talk about 30% of the people are asymptomatic but carry the virus. To me, that tells me that we're going to get to herd immunity pretty darn fast on this virus. Is that a correct statement?
No, and so let me just make sure that you're understanding what I've said. Of the people who are carrying the virus, up to a third of them may not demonstrate symptoms. And so somebody who's 80 years old, that percentage is much, much, much lower. It's essentially, zero for an 80-year-old to be carrying the virus and not have some symptoms. For somebody who's 5 years old, it's somewhat greater than 30% if they are carrying the virus that they would not demonstrate symptoms. To your question about herd immunity, which is the concept of a large enough number of people in the population having immunity to the virus, either because they've been infected and survived it, or they've received a vaccine and been protected from it. basically a majority of the population has to be immune to the virus for that to occur, so that those who haven't been exposed to it will be protected. It's sort of like, I'm trying to think of a good analogy. It's like if you plant a field full of wheat, it's hard to grow a tree in the middle of the field full of wheat because the wheat is covering all the ground and soaking up all the nutrients, perhaps. That's probably the best analogy of herd immunity. But here's the problem, is that one, that massive amount of the population needs to have been infected, in which case we're going to have an overwhelming number of hospitalizations, critical illnesses, and some significant number of deaths, which is tragic and can be avoided by implementation of face covering on a population-wide basis. The second thing is we've now learned in the past couple of months that immunity to this virus, when it's naturally acquired, so somebody is out in the world and they happen to get coronavirus and they get sick and they recover, that immunity doesn't last forever. And the latest data, and this has only come out this week, suggests that the immunity can abate or go away in as little as a few months, and certainly by about 6 months' time. What we don't know is how many people hold on to immunity longer versus how many lose that immunity sooner. But what we do know is that the virus can come around again. So naturally acquired immunity, which is what you're suggesting here, if there's enough asymptomatic spread and we don't cover people up, because source control is what controls the asymptomatic spread, is everybody has a face covering. Therefore, those asymptomatic people don't spread the virus. It's contained within their mask. Those that do acquire the virus, though, their immunity is going to wane in a matter of months, and then they can acquire it again. And that concept of herd immunity based on naturally acquired infection disappears. So what we have to depend upon is surviving from now until a vaccine that is highly effective is available, and we immunize a massive amount of our population to protect us. And we can talk about the timing for that, but it's certainly not on the immediate horizon, and we'll be lucky if it happens by the end of the calendar year.
Dr. Nemerson,
Dr. Nemerson, this is Chairman Nettleton. Do you have any comments on the virus, the propensity of mutation that it is demonstrating?
I think the only comment that I have, and I would defer to an infectious disease expert for real detail, but the only comment that I would have is there's no evidence that I have read that suggests that the virulence or the propensity to injure people, make them sick, that the virus has mutated in any way for that to happen. There was one report a few months ago that suggested that was a possibility, but in point of fact, it has not been validated. And it also doesn't really make sense because basically illnesses spread for two reasons. One, the more contagious they are, the more they spread, the more they grow, et cetera. And then the second is the more they're able to make you sick, the more effective they are at infiltrating your body, the more likely they are to be able to get out of your body and infect somebody else. But the bottom line is that, one, no evidence that the virus is weakening, and two, no evidence that it's becoming less infectious. And in fact, there is evidence to suggest that it's becoming more infectious, more readily spread, as of some studies that came out in the past month.
Betty Ann, this is Diana.
Yes, go ahead, Commissioner Lacchiando.
I just want to follow back up, Dr. Nemerson, on something you said earlier. So are you saying, I mean, we've had a lot of questions about people who think for a medical reason that they aren't able to wear masks, et cetera. But I just want to make sure I'm understanding you correctly. So you're noting that if you have a very severe respiratory issue, et cetera, that would preclude you from wearing a mask, you probably shouldn't be leaving the house anyway. You should probably be sheltering in place, or help us follow along there.
Well, no, I don't think I'm saying exactly that. What I'm trying to explain is that there are really two basic reasons for which somebody with a health condition would not be able to safely wear a mask. And those two reasons are, one, the mask is just too difficult to breathe through, and so the force that's generated between their mouth and nose and their lungs is increased, or the pressure against which some has to breathe is sufficiently high that it then compromises their breathing or compromises their body's ability to generate the pressure necessary to get the air in and out. So that's pretty darn uncommon. And somebody who would have that kind of weakness would be generally so physically weak that they're not going to be walking around very easily at all. And, I kind of just ask you to think about yourself and everybody that you know. Can you imagine a person who literally can't breathe through a mask, get the gas in and out? And by the way, remember, we're talking cloth masks here, so we're not talking about some kind of incredibly tight-fitting, stiff material. And we would ask people to pick a mask that works for them, right? Pick a cloth. If you put it on and it's uncomfortable, find another one that isn't so uncomfortable. Understanding that the more filtration, the better. But in any event, so that'd be one possibility, is you literally can't exchange air through the mask that surrounds your nose and mouth. The second possibility, which is really the more medically likely and still very rare circumstance, is that the gas that you breathe in and out, some amount of it is trapped within the mask itself, between your mouth and nose and the interior of the mask. That small space captures carbon dioxide. And that carbon dioxide is diluted by the air that you're breathing from the outside significantly, but there's a small amount that's captured there and goes back into your lungs. Well, somebody who has profoundly severe respiratory disease, where the air inside their lung doesn't exchange with their bloodstream well at all, that little addition of carbon dioxide can be weakening to them, can be compromising to them. And these are patients that have, for instance, profound chronic obstructive pulmonary disease. And generally speaking, those are people who get so winded just walking out of their house that they're not going very far. Or if they're being taken somewhere, they're being taken in a wheelchair to the automobile, they're on oxygen, etc. And wearing a mask is fully compatible with wearing oxygen. You can put the oxygen device underneath the mask and still contain the virus within the mask. So it's going to be very, very, very uncommon to have someone whose physician says, nope, this person really cannot wear a mask.
Thank you.
Further questions, Dr. Nemerson? Yes, go ahead, Elton.
Mr. Nemerson, I'm still a little bit confused, because on the herd immunity issue, I think that's where we're all trying to get to eventually through vaccinations or exposure. And if a person loses that immunity after having the disease in 2 or 3 months, are we ever going to reach herd immunity?
We will through vaccination.
Only through vaccination, though.
That is, at present, what appears to be the case. So that tells me this is going to be around for a long, long time. Well, I am certainly hopeful and, in fact, optimistic that within approximately the next 1 to 2 years that we will have a highly effective vaccine. And there are currently 2 vaccines that are in clinical trial now that are expected to produce sufficient results to know whether they're safe and effective by the end of the calendar year, in which case, if we are lucky and one of those are good, then come the year 2021, we would be mass producing vaccine and be getting people vaccine shots. However, there isn't even preliminary data out there to know whether or not they're going to be effective. And the ones that are in trial now are sort of based on older technology, which means that their likelihood of being highly effective is less than some of the others that are moving in the right direction but may come on later. So what I can't do is I can't predict when and if we are going to have a highly effective vaccine. I'll give you a useful analogy because I'm trying, I respect the angst that everybody has in our communities and the passion they have around this issue. So I want to make it practical and understandable for everyone. When we talk about vaccines and vaccine safety and this concept of immunity, think about it in terms of the other viruses that are out there that we don't have vaccines for and that we've been suffering with for a long time. So the AIDS virus or human immunodeficiency virus, HIV, it's been around for decades. We've been on a vaccine all that time, and there still isn't one available. And there have been trials, and they failed. Similarly, Ebola virus, now limited to Africa, but highly, highly deadly. Vaccines being worked on, still not a virus. So this particular virus isn't a relative of those others, thank God. We are optimistic that there are mechanisms by which our immune system can be primed by a vaccine to be able to attack it, and I feel very optimistic that we are not going to fail to find a vaccine. What I don't know is how long is this going to take, and what I do know is it's not going to take a week, it's not going to take a month, it's going to take many months, and it may take more than that. It may take a year or two. And we've all heard the media reports, excuse me, by experts who are working on these vaccines, and the consensus is that we're looking at another year plus to a truly successful, highly effective vaccine.
Dr.
Madam
Nemerson,
Chairman.
this is Chairman Nettleton again, and this may be a very premature question to pose. Do we have any idea if this will be an annual vaccine, like the flu vaccine, or not at this point?
We don't.
Okay. Thank you.
Madam Chair, this is Ted Epperle again.
Yes, Ted, go ahead.
Yes, thank you. Dr. Nemerson, two additional questions from me as we regard the public health strategy that we'll be acting on here shortly. Ideally, it would be perfect in our community if we could get 100% masking. That would be a wonderful goal to set. We all recognize that practically that's not going to happen. At what percent do you think of public masking and face covering would we need to really minimize this dramatically? I recognize the more the better, but is there any data that you're aware of in terms of what the compliance rate in our community needs to be at roughly to have the most impact and make a big difference in the disease? That's question one of two, and I'll hold on my second question until you respond to that.
Yeah, so I've not read, and I don't have the requisite expertise, unfortunately, to be able to answer that question. I can definitely take that back and try and get some answers for the committee. I will tell you, though, that, you know, to say what you just said, the more the better. And the important concept to recognize is that the mask you wear protects yourself to a small extent. It protects others from you to a great extent. And so the importance is that when we're out in the world and we are grocery shopping, going to the bank, doing whatever, and we're crossing people's paths, the more paths that we cross that have been made by people who are wearing face coverings, the safer we are.
Thank you. The second question, if I can, Betty Ann.
Yes, go ahead, Ted.
Okay. The second question is, from a public health perspective, then, I would infer that it's going to be best, as we contemplate the health of the public, to have as many people covered as possible. So I just want to reiterate that it wouldn't be an effective strategy to have large groups of our population uncovered. So as we go forth, you know, through the next several months to a year plus of this, I would think from a public health strategy that the more we do with school children as well with face coverings would be a more effective strategy from the public health perspective in terms of trying to keep the health of the public maximized. Would you agree with that?
Yes, unquestionably.
Okay, thank you.
Madam Chair, this is
Further questions, Dr. Nemerson? Did I hear Elt?
Yes.
Yes, go ahead, Elt.
So, Dr. Nemerson, I think the issue that we're really, the base issue is we've got if you're estimating 30% of our public is asymptomatic, but they're carrying the virus, they're not sick, so they're not reporting it. Those are the ones then you might say that are infecting everybody else. Is that correct?
No, and let me go back and say it's of those in the population that are infected, a third of those may be without symptoms. And ask your question again as far as then covering those who are asymptomatic. Well, I think I understand it, which is then, yes, of course, if somehow we could identify only those who have no symptoms and are carrying the virus and cover those up, that would be critically important. But two, the majority of people who are infected do not end up hospitalized or quarantined. Yes, they're symptomatic. They may or may not know that they have coronavirus because they may believe that they have another illness. They may believe that they have allergies or asthma, or they may know or believe they have coronavirus. But those individuals, all of those individuals that have COVID-like symptoms would, to protect the rest of the world from them, would have to sequester themselves. And that does not happen under even the best circumstances. And we don't want to go back to shelter in place where we force everyone to stay in their homes and not be able to function. The beauty of wearing masks, and I liken it to wearing a seatbelt when you get in the car in some ways, is if everybody does it, protecting themselves and they're protecting other people, and then we can stop this astronomical growth that I described to you earlier, which is frightening all of our healthcare systems and healthcare providers right now, because we know that it's, even if we start today, and we should start today, it's going to take 2 to 4 weeks before we see the actual bending of the curve. Because remember, those that are acquiring the virus as I speak, they're getting the virus. They're not going to be symptomatic for a handful of days. If they get hospitalized, that's not going to occur for a week or two. And those that are going to end up in an intensive care unit and, God forbid, die, that timing for that is also not going to be for a couple of weeks. So, so the terrible numbers that we're seeing right now, which are due to the fact that people are out in the world taking pleasure in being alive, but not wearing a mask. What we're seeing today is a reflection of what was happening 2-3 weeks ago. My goal, my passionate plea to this body is, please help me get the message out to people to take care of one another. Cover your nose and face so that we can bend this curve back and get to the point where we don't have a catastrophe that's currently building, and we can start talking again about getting back to school, getting back to work, because we bend that curve and the incidence comes way back down, and maybe we don't have to take the draconian measures that would be required if this continues to explode. And make no mistake, and I'm speaking for myself here, please, not for St. Alphonsus Health System, not for any other health system, but merely speaking for myself as a person, as somebody who cares very deeply about the state of Idaho and the people who live in it and the people with whom I work. The train has left the station. The COVID train is moving. We are headed to become New York, California, Arizona, Houston. But what we have, and the gift that we've been given, is time to turn that train around. And covering everybody's face, for those who will respect this and understand the message, it will make a big difference.
Thank you, Dr. Nemerson. Any further questions for Dr. Nemerson or discussion?
Betty Ann, this is Jane.
Yes, go ahead, Jane.
I just wanted to thank Dr. Nemerson for his perspective and his words. They mean a lot, and it gives us energy to continue and carry out.
I also, Jane, would like to add my thanks to Dr. Nemerson. Thank you for your time and your expertise. Very important concepts and words at a very critical time for us, so thank you.
Yes, and as chairman, Dr. Nemerson, I would echo that gratitude from our whole board.
Well, thank you. It's a privilege to participate. It's a great deal of time. The angst I experienced it myself personally. I could say a lot of things, but I think the most profound one I can say is I absolutely hate coronavirus, and the death of this virus cannot come too soon by vaccination. And in the meantime, I hope we can take care of one another and help us to get through this, so that we suffer minimally and we enjoy life.
I know that's not a motion, but I'll second that.
Yes, absolutely. Well, once again, thank you for your time and your expertise, as well as your very easy to understand explanations. We appreciate that for our audience particularly. So.
Sure.
Okay. Moving on our agenda, agenda number 4, we're talking, voting on amendments to a Central District Board of Health bylaw, and I will defer this conversation to Director Duke at this time. Russ, would you like to give us an explanation on what we're doing here?
Yeah, sure. I was on mute. The bylaws were provided to you in advance of the meeting. I noted the changes, so I'll just quickly review those. On page 3, at the very top, it was noted that telephone meetings may be held, providing proper advance notice is given. Well, clearly things have changed and now we have video conferencing technology. So that's what I added. That's what we're going to be doing from here on out, certainly for the rest of this year. And then the material change would be on page 4, where we essentially have a chair, a vice chair, and a trustee, but we don't have the 4th layer for a person to chair the meeting. Should those 3 individuals be gone, yet 4 out of 7 is all that's required to have a quorum. So I added the language that the duties of the longest serving board member present at the meeting would be the one to chair the meeting should the 3 positions of leadership not be available. And those are all the changes.
Okay, thank you. Thank you, Russ.
Betty Ann? Betty Ann,
yes,
this is Megan.
go ahead.
Motion to approve the changes to the bylaws.
Okay, the motion has been made to approve the amendments to the bylaws by Representative Blanksma. Is there a second to the motion?
This is Helt. I'll
Yes, second.
Okay, second by Commissioner Hasbrook. I will call for a roll call vote, starting with Ryan. Are you on from Boise County yet? Evidently not. Okay, we'll proceed to Ada County. Jane?
Jane Young, aye.
Dr. Epperly?
Ted Epperly, aye.
Commissioner Hasbrook?
Commissioner Hasbrook, aye.
Elmore County Representative?
Megan Blanksma, aye.
Okay, motion passes with unanimous vote.
I think you missed me, Betty Ann, but I'll say aye
Oh,
as
I'm
well.
sorry, Diana. I'm sorry.
And it
What
looks
is
like
your vote?
Ryan is on. I just don't know if he can hear us but not speak. So Ryan, if you want to go in the chat box, let us know. Maybe not.
Okay, and Diana, your vote is
Aye.
aye. I can barely hear you, Diana, so I do apologize for my my oversight there. Okay, the motion does pass to amend our bylaws in that regard. So moving on to the next agenda item is discussion and vote to approve amending regular Board of Health schedule. And once again, I defer to Director Duke.
Thanks, Madam Chair. So the schedule is brought up on the screen, and essentially the only change to our regularly scheduled meetings, which were noted in an asterisk, so August 21st, October 16th, and December 18th. All of the other dates are Tuesdays at 4 p.m. So that was the proposed agenda that we've talked about, and I just wanted to formalize that today, knowing that any of those meetings could be canceled at the pleasure of the board. I just thought it would be important to get them as regularly scheduled board meetings on the calendar for your benefit and for the public's benefit. Looking for a vote to approve.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Yeah, I would make a motion to approve that calendar. I think it's going to be very important over the next 6 to 12 months to have a regular scheduled meeting in place. Again, as Director Duke said, if things change, we can always cancel them. But I think the magnitude of the situation is such that we need to keep a weekly schedule until further notice.
Okay, thank you, Ted. Is there a second to the motion?
I'll second.
Second.
This is Diana.
Okay, thank you. We'll do a roll call vote starting with Boise County.
Madam Chairwoman, really quickly.
Yes, go ahead, Representative. Yes.
Just a point of information, and I don't know if Mike Kane is on the line or not, but do we, just to be clear, since there's been some difficulty, is it a 48-hour notice of cancellation for any scheduled meetings, according to the open meeting law?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So I was notified by Mike that he just had to step off the call. He had another appointment at 5 o'clock.
Okay,
So
Madam Chair, Madam
is
Chair, I'd be happy to defer for later. I just want to make sure that we're all clear on that if we're going to add all those meetings to the schedule.
Okay, any further discussion on that as part of the flavor of the board so that we do get this motion right?
Yeah, this is Commissioner Hasbrook.
Yes.
My question is to Megan, is this a new thing in open meeting laws where it went from 24 to 48 hours on cancellation?
Madam Chairwoman, Commissioner
Yes,
Hasbrook, I am not 100% on the cancellation for open meeting laws. That's why I just want to be clear before they get added, since there's been some difficulty.
My understanding was you could cancel a meeting up to before the meeting starts. But I could be wrong, so we need to look into that.
Well, with that in mind, do we want to go ahead and at least approve maybe the next 3 meetings? And then we'll get clear with Mike Kane. So at least the public knows that we have these meetings on the books for, the next 3 weeks out.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Yeah, I think just again for clarity, I think we should approve the calendar as it now exists. If we find that we're not exactly right about the length of cancellation, then we can bring this agenda back, the calendar back up and make modifications. If we take just a partial number of meetings, we may forget where and how many we had. I would just rather approve what's written here, published here for all the reasons we've said. If we find with approval today that that's not right in terms of cancellation, I don't think we can foresee cancellations in the near future, but if that's not right, then we can have a separate agenda item at another time to so modify. But I think right now it's published, it's here, it's right in front of us. I would say that we approve this schedule and then modify downstream if we're not accurate.
Any further discussion on the motion? Hearing none, the motion has been made and seconded. I will take a roll call vote. Boise County, are you on?
Ryan says aye via the chat.
Okay, Ryan. Boise County indicates yes. Is that correct?
Yes.
Yes.
Okay. Moving on to Ada County, Jane.
So the motion is that we are accepting it as it's published right now, and we'll change it in the future if we need to.
Correct.
Jane Young, aye.
Dr. Epperly.
Ted Epperly, aye.
Commissioner Lacchiando.
Diana Lacchiando, aye.
Valley County.
Aye. Commissioner Hasbrook.
Elmore County.
Megan Blanksma, aye.
Okay. The motion unanimously passes that we will proceed with this schedule until, if any changes are indicated, we will take it up in the future. Okay, our next agenda item is discussion and vote regarding potential actions to protect life, health, and safety within the district as to the COVID-19 pandemic, to include potential amendments to current public health orders for Ada County and consideration of orders for other counties or communities that include, but not limited to, mandating face coverings for the counties within Public Health District 4. The floor is open for discussion.
Madam Chair.
Yes,
This is
Commissioner Lacchiando,
Diana.
go ahead.
Thanks. This is Diana Lacchiando. I maybe would like to start out by hearing from Elt, and I'm sorry to put you on the spot, Elt, but we missed you last week, and we did talk about Valley County, and so I'd love to hear your perspective. One of the things we talked about and talked with our healthcare leaders about is you know, on any given weekend, we, you know, have 15,000 people per chance going from Ada County, especially up to Valley County. And we almost kind of need to think of ourselves together. And I'd just love to hear where you're at and what the concerns are in your community.
Well, first of all, thanks for putting me on the spot. I will get even. No, thank you everybody for reconfirming me to get back on the board. I'm very interested in how all this is going to work out and the long-term effects. Yesterday at Commissioners, we had a great discussion about going back to face masks and, you know, social distancing, all those kind of requirements. McCall City has already done that. They've made it mandatory. We did not make it mandatory. We made it advisable, or made it, you know, more, what's the word I'm looking for? Voluntary?
Encouraged.
Encouraged, yeah, thank you. Thanks, Doc. Because the main issue, honestly, is that our law enforcement isn't going to enforce it. And I think you guys have the same issues down there in Ada County, that people know that there's not going to be enforcement. So, you know, 30, 40, 50% of the population is kind of thumbing their nose at us. I have a feeling that the good Lord will balance those kind of issues out down the road for those folks that think they're invincible. But right now, everything we've done up here has been voluntarily. We've been advising the businesses, especially the restaurants and the bars, that you guys really need to think about social distancing, about making your employees wear masks. Because I think down the road, in another month or two, we're going to see people that are going to probably become liable for the actions that they've taken at their business for not protecting not only the public, but maybe their employees. We've done a great deal at the courthouse on COVID safety, and we have kind of a revolving schedule for employees. 2 weeks ago, Saturday, I was actually exposed by a 74-year-old friend of mine, and I left a commissioner meeting in the middle of the meeting after I got the text, which is really kind of a weird feeling, and came home. And I've been home, and I've been quarantining ever since. My friend was asymptomatic, but he is in a local hospital down in Boise until he can test free. So it's kind of like scared people. Does that make sense? All of a sudden, everybody realized that it's a little bit closer than they thought. But I'm still getting a lot of heat from folks that think it's got a very small death rate. It's only 0.3%. And it's because we haven't really been hit by it yet. It hasn't really gotten up here yet. But I know from talking to the locals that most of them, they pretty much just camp on the weekends and at home. They don't go out. They don't get involved in a lot of stuff because we're kind of overrun with, you know, the weekenders, and we love them, and they come up and they support our economy. But believe it or not, if you look at traffic studies, there's more people that go to Garden Valley than come up here every weekend. So I think, you know, Boise County is probably looking at the same kind of issues. But until we get to a point where, you know, law enforcement gets involved, I think we're going to have a hard sell all the way around. And that's pretty much all I got.
Thank you, Al. Other input?
Madam Chair?
Yes.
Madam Chairwoman?
I'll go ahead.
I just had a couple of comments, and just to piggyback on what the commissioner was saying about enforcement. And if we're going to set a policy as a board, I think we need to make sure that it's meaningful and we know what results we expect and how we're going to get there. And I know that enforcement in my own county would be difficult and isn't necessarily public supported. And I think what we got from the doctor's comments was we're looking at a long-term situation. And so I'm just wondering if we can't be a little more proactive about, well, in particular, hand washing, social distancing. And everybody wants to focus on the masks, and I'm not here to have the mask commentary. I'm here to have the discussion about what we can do to have the most effective results which would be, not to overwhelm our health systems. And I think maybe there might be a way we could do that with some more education outreach, going to some of these local groups, trying to let people know what kind of, just with regard to disease spread, how it works, so that when it's something else, people have been educated and we're not starting from zero. Because I kind of feel like we've been really reactionary, and I appreciate sometimes that's just the situation we're in, but we're at a point, I think, where we need to talk about how we can do some long-term education outreach type programs to help keep people safe. And I am concerned that if we're going to set the policy, we want to be seen as trying to set an effective policy and something that works, rather than just a mandate that doesn't necessarily have an effective end because it doesn't get enforced. I'm concerned about that.
Madam Chair.
Thank you. Yes, Commissioner Lacchiando.
I want to speak to a couple of those, and obviously we're all sort of experiencing different things in our different communities, although the virus doesn't care where we live. So here in Ada County, I've noticed a distinct difference, just having, traveled around the county for various things, going into grocery stores, restaurants, between when Boise put in their mask order versus the rest of the county. And I don't, sort of, Elle has a great point. I mean, all we have is a misdemeanor, and that's different than other communities or other states where they have the ability to cite an infraction and folks would pay a fine versus, going the misdemeanor route, which I think no one really is interested particularly in that. But that's all we have. And I have noticed since the mask mandate went into effect, there's a significant difference in adherence in Boise versus the rest of the county. And hopefully in what I'm hoping is a non-confrontational way, I've just inquired, can you share with me why you aren't wearing face coverings, et cetera, at restaurants or grocery stores? And the answer that I've gotten back is our management isn't going to make us do it until the government says they have to. And I find it so frustrating because I know from a public messaging perspective, we've been begging, we've been pleading, we have PSAs that are going out, but it's on the news, etc. And it seems really antithetical to me. I'm a native Idahoan, that we'd have to have the government tell people what to do. But that's what we're hearing from these business owners, and also what we're hearing from business owners is that they don't feel protected if they're the ones telling customers they have to wear the mask. It puts them in a difficult position with people who are patronizing their restaurant or their grocery store or whatever. So we're in a situation where no one wants to be the one to say people have to do it, but I'm finding that to be the case.
Can you guys hear me now?
Yep.
Yes, Brian. Welcome. Thank you.
Finally. Okay. So real quick, I did want to add some 2 cents in here. So just now, tonight at about 3:15 or so, Boise County went ahead and mandated for every county employee to wear a mask to work. I don't know how many of you folks are aware. We did do voluntary crush the curve testing last week on Tuesday, and we had about 36 people that participated in that event, and we had 2 positives come out of that event that were asymptomatic, and those 2 individuals have of course been quarantined and aren't allowed to come back until there's a negative test. But we did what we did because we were trying to get a baseline number and thought we would get more participation, and we actually didn't get very much participation. We got about 50%, which is pretty reasonable, I guess, from a hope and pray standpoint. But today we went ahead and, like I said, we implemented the mask policy. We have taken it back down to county residents by appointment only for like our DMV. All that stuff starts at midnight tonight. We made that decision and it has upset a lot of our employees, and there's obviously going to be some legal questions regarding what our authority was to be able to, we've mandated testing for everyone. So if you work for the county, you're going to get tested. I don't know what the plan is for enforcement on that, but that's what we've come up with. So we can get a baseline and know where we're at, because as Elt has said, I can't, on Thursday night of last week, Thursday at all last week, I could not have driven to Garden Valley. It would not have happened. I live in Horseshoe Bend and I could not have driven to Garden Valley. It would have taken me 3 hours to get the 25-minute drive from Horseshoe Bend to Garden Valley. And that's just how we've been. I drove to my commissioners meeting this morning and I've got 15 people camped on parking spots on Harris Creek Road out in the middle of, just parked off the dirt road camping. And that's just kind of what we're running into. But we have people even coming from Oregon and Washington to our DMV because their DMVs are closed and they're wanting to get like passports or things that can be done basically internationally, right, or within the continent. So there's been folks that have been coming from, we ran into some folks today while I was at lunch that were coming from Oregon to get a passport because their passport services and DMV services are shut down in Oregon. And we're going to start seeing more and more of that. And I don't know, I'm with all of you guys. We're in a really rough spot, I think, and no answer is going to be the right answer. If we're in a spot where if we say no masks, and we start a messaging campaign, I think that something's going to happen. Obviously, we kind of know that. Dr. Epperly knows that probably better than any of us. Something's going to happen, and we're going to get strung up for it. And on the other side of this whole thing is if we go ahead and put in the mask mandate right now and do our best based on the information that we're being given from the healthcare professionals to, crush the curve, so to speak, and to do our job as leaders of a community and try to enhance our response to this whole thing, we're going to get strung up for that too. And I think that, my email box is crying right now because it doesn't even stop dinging. As we speak, it's going off. I've gotten hundreds of emails in the last 2 days mostly from Ada County begging me to vote no today. And it's been weighing on me really hard, and I wanted the board to know this. From someone that came out of literally nowhere into politics, and I'm getting an extremely crazy crash course in politics in the last 12 months. It is a hard decision to make, and I feel like at the point where we're at right now, I have no choice, and I don't think anybody on this board does. Outside of going with, what information we have. There's no right answer, and I know everybody has information, but I would like to think that the doctors of these healthcare systems that we trust with our lives, they don't work for us. They don't work for the government. They don't work for Central District Health. And I would like to think that they have everyone's general safety and concern in mind. And I would like the public to know that too. And I think that, at the end of the day, a good human being does what's right for his fellow man, his or her fellow man. And I feel like that's the right thing to do. Take care of yourself in order to take care of everybody else, because you can't help anybody if you can't help yourself. And, I know for me and my family, when we go out into Ada County, we go out around people, we go to family events, we wear masks and, and we take care of ourselves. And I've talked to Diana about this quite extensively. I don't believe it's a Republican thing, and I don't believe it's a Democrat thing. It's a human thing. Be a good human and understand that, it might save someone's life, and you should be able to feel good about that. at the end of the day. And if it inconveniences you for a short period of time to save someone's life, so be it. I mean, that's life. And that's my 2 cents. I'll stop. I wanted to get that out there. I tried to talk last meeting. I couldn't due to microphone issues, but I got it fixed today. And so I just kind of want to let everybody know where I stand. I've been getting a lot of conversations.
Madam Chair, this is Ted Epperly.
Thank you, Ryan. Yes, Ted, go ahead.
Yeah, Ryan, I really appreciate your sentiment a lot. It's very real. It's very sincere. What I would like to say to our group is that we have a real serious problem. This isn't made up. It's not a hoax. This is a serious community outbreak of the largest virus pandemic I have seen in my lifetime, 40 years of being a family doctor. This is a significant issue. We have just heard, I think very clearly, that the triad of public health, face coverings, social distancing of a minimum of 6 feet, and hand washing are the best things we can do at this time. Without a vaccine, without an antiviral treatment, the public health measures is what we must do. We are not here to make a political decision. We are not here to make an educational decision. We are here to make a health decision. And if I were to be asked, Dr. Epperly, is there something we can do to reduce the impact of COVID-19 by 85%? I would say absolutely, let's do that. We have that within our reach, and that's face masking for people. Now, it's up to every individual to comply with this or not. But from a public health perspective, this is really clear. We must do that. It is the right thing for the community. It is the right thing for people's health. It's the right thing for public health. If we do this right, not only will we help decrease the spreadability of this disease in our
Did we lose Ted?
I lost somebody.
We
I
lost
can't hear
Ted.
anything.
I lost Ted.
That was a good, he was on a good track.
Yeah.
Well, Betty Ann, this is Diana, if I might follow on.
Yes, Diana, go ahead.
So following along with Commissioner Sturm, I'm similarly been inundated from all sides. I just don't know how much more clear our healthcare leaders could be. They are asking for this. They're begging for it. They are watching their hospitalization rate fill up. They had one of their nurse practitioners pass away yesterday from COVID. And if anything, I'm worried it won't be enough. And I really am coming at this from, we have a simple measure it's not fun. I have an 8 and 11-year-old who, have to wear face coverings, and no one likes it. But we have a simple measure that hopefully can prevent further infection that can keep us from going back to stage 2. And I'm really worried about our economy if we have to keep going backwards. So that's where my head is at. It's how do we preserve health and try to preserve the economy, and we've got to try to do this.
Betty Ann, this is Ted Epperly again. I'm sorry, I think I cut out.
Yes, you did, Ted. Go ahead.
My computer ran out of power.
Oh.
I forgot to plug it back in. I'm sorry. There were just 2 other points I wanted to make, and I apologize for that. The first was, I think it's really clear that we have an opportunity here to really make an impact on the virus, and we need to do that. I think it is the right thing to do. To Ryan's point, at the end of the day, we've got to do the right thing from a public health perspective. The other thing I would just add is that it's more than health that we're being able to impact in a positive way by doing this. We actually will improve the ability of people to continue to work, for jobs, for employers, for our economy. This is a very simple measure we can do that will keep society functioning. To not do this would be, I think, a tremendous mistake on our part, because we knowingly have the opportunity to impact these in a positive way at this juncture. So I would ask us to do that. Dr. Nemerson is correct. The train has left the station, folks. We're in the midst of seeing this worsen. This is what we can effectively do, and I think must do at this juncture. So with that, Betty Ann, I'm prepared to make a motion whenever other people have had a chance to give their thoughts to this and move us forward.
Betty Ann, this is Jane.
Yes, Jane, go ahead.
I just wanted to add my 2 cents too, and I really appreciate what everybody has said. And that is that being on the front lines and dealing with patients day in and day out, I feel very strongly that we need to go forward with a mask. And I agree with Megan that we can use education, but I think we need to do something hard and fast now in order to make a change going forward. So I think when we look at our neighbors and we look at our families and we look at our friends, the one thing that we can do to connect and to keep people alive is to start with a mask.
Thank you, Jane. Further discussion?
Betty Ann, this is Representative Blanksma.
Yes, Megan, go ahead.
If I may, just one more time, please. I am not discussing whether it's beneficial or not beneficial to wear a mask. I have deep concerns about what the chain reaction is to it, and if we're doing enough planning ahead. So already the commissioners from Boise and Valley County have some concerns, but right now, if I understand it correctly, you're going to do an order in Ada County. That's going to be the proposal. Well, I would like to get to the point where we start talking about other solutions, just waiting till we get the point to this point. And I don't think we've done that, and I'm concerned about it. And I'm also concerned about a lot of the consequences of putting a mandatory mask covering, however you want to call it, order into place. We are considering it without even talking about, there's a little blip on enforcement. There's a question of how do we administer this? So are they going to call Central District Health and then it gets reported back to the police and then the police go to whoever was reported so that they have time to educate? Do they have the kind of man hours for that? What about the call rates that are going to start coming in to sheriffs and local police departments? Does this mean that it's going to increase confrontation in the community between people who have a mask on and those that haven't for whatever reason, even if they do have a physical problem that creates a difficulty for wearing a mask? Or I know that there have been people who have actually been compliant with the Boise order, maintained their 6 feet social distancing, and have also been mask shamed. So I'm worried about creating conflicts within the community. And I would just really like to reiterate that as much as I appreciate wanting to keep people healthy, and I agree that the more you can do to keep your family and friends healthy, the more you should do. Always been a big believer in hand washing and social distancing. And for those of you who are around me for any considerable time, I have a very large bubble and I like to keep it. But I think that we are doing ourselves a disfavor by not coming through with some sort of a long-term plan for education and outreach and continuing to push that. I don't think PSAs on social media are enough. We're going to actually have to engage the communities locally and talk about how important this is. Because if, as the doctor says, this is a long-term problem, then we need to start coming up with a long-term solution. And I don't know that what we're doing right here is necessarily sustainable. And I don't know that we've had that discussion about the sustainability of it.
Madam Chair.
Thank you, Megan.
This is Diana, Madam Chair.
Betty Ann, I'd like to chime in about my own county. And of course, we have a large geographical area. Our main center of population, of course, is Mountain Home, with Glenns Ferry being second. we don't even have a full-time police officer in our second largest community. If we have to send an officer to King Hill from Mountain Home or into Atlanta, we're kind of in the same position that Ryan is, even though there's not a mountain between us. If you were to send an officer from Mountain Home to Atlanta to issue a citation, you're talking about basically one man a day for that employee by the time he makes the trip and performs, what he has to do there. As far as our court system here is already overwhelmed. Our jail is, if we're going to put teeth in this, we just don't have the manpower to do this. Our numbers, fortunately, are not going up fast, and I think if we had some local education and could at least post, this is just an example scenario, if we had some COVID dollars to station a person wearing a mask with a big banner and a handful of masks at a Walmart and Albertsons, I can name probably 4 places in our county that would reach basically all of our populace with education, so that, it's not the hammer, because the hammer is not going to be met with favor in our community nor with our Board of Commissioners.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
I'd like to speak to that. I mean, I think we could eventually talk about other counties, but really I'm your Ada County Commissioner here, and, I'd be happy to share what we've been doing on education already, as well as the law enforcement conversation. So we have been hard at work on education, and, there's more and more that we need to do. As I said, we have PSAs in development. We have been working with our local health systems to help them amplify the message. As we speak, we currently have a huge event happening with volunteers at Expo Idaho, handing out masks for free. We have 3 more events scheduled to get those out. Our Ada County Emergency Management, we have been meeting, as Russ knows, our policy group has been meeting twice a week for the last 5 months. So while this Board of Health hasn't been meeting as frequently, this has been on our radar all day, every day, for a long time. And unfortunately, as I said before, we're just not getting there. We're just not getting there with where we need to be in terms of adherence, or we would see these numbers driving down. And so I think we need to send a message. We do have enforcement challenges. As I said, per Idaho code, we only have a misdemeanor. We don't have an infraction. Representative Blanksma, you could help us out with that, perhaps in another session. I know our law enforcement officers, if they were called upon, would much prefer to write a ticket than a misdemeanor. They are going to lead with education. And Russ and I had a chance to sit down with all the law enforcement leaders in Ada County last Thursday and really talk through what this could or should look like. We're in the same boat. Our court system is incredibly backed up because of coronavirus. Nobody wants to cite a misdemeanor. So we are going to have to lead with education. And then we may need to get creative. And Russ and I have had a little bit of conversation around this about utilizing some of our food service inspectors to continue that education. Right now, they're going out 30 visits a month and writing things up. Your refrigeration is off, or your hand sanitizing isn't great. I don't see why we couldn't continue that process. Then I know they are to a degree on their adherence to face coverings. We could also look at, and when I say we, I don't mean this board, I mean Ada County, at the alcohol licensing process. And that's a conversation that we have already had here at Ada County, that we are no longer supporting alcohol licenses for events over 50 people per the rollback to stage 3 here in Ada County. So we have some other avenues to get at this that don't involve a misdemeanor, because I know that's not a path that anyone really wants to go down. But I strongly feel we have to back up our healthcare systems. They are begging us for help, and we've got to do this.
Madam Chair,
Yes, go ahead, Ryan.
So I do have a couple of points I'd like, clarification on, and then of course information. Number one, I'm curious how do I put this? I'm curious what the repercussions are going to be when 7,400 Boise County residents come flocking into Ada County because they're all sick and there's no doctor here. Is it going to be that severe? Unlikely, but 200, 100, 200, 300 is possible. I I don't know that there is no long-term solution for this problem currently that anyone in the world is aware of. And so speaking to a long-term solution, it's it's hard, and I agree with Megan. I would love to see a long-term solution and make that the plan and go forward with that, and that would be perfect, and I would be 100% on board with that. And I think the issue that we run into is we've got less than 45 days before our kids start hanging out with each other again. We've got 45 days before we've got to figure out what we're doing with sports. And, not us, but, the state itself, all these traveling sports teams and what they're doing. We've got a very limited time to figure out, are we going to sit on it for 2 weeks and wait to see what happens? And then also, we've tried PSAs, like, Diana has said they've had PSAs. We've here in Boise County have made it very clear to folks to, social distance, which it's easy, as Elt knows, it's easy for us rural county people to social distance. Not so much for Ada County, but for the other three counties, it's fairly easy. And I think that that's probably what's helped us the most, being, not being so crowded in malls and shopping centers and things like that all the time. And I think that that has helped us. But we've hit a point where you have a group of folks that really, 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 and I'm not saying they're not warranted in their concerns. I've shared the same concerns, but they're really they're uneducated in exactly the facts, and because of that, they're very, very, very scared and very, very concerned about any type of a mandate or request or anything that any government agency or pseudo government agency puts out there. And they're going to fight it tooth and nail. And I understand their concerns. I really do. I just know that those folks are not going to, it doesn't matter what you ask them to do. Get a vaccination, that'll be the next thing. You know, we're talking, if you follow Dr. Nemerson's advice and information, our next step to fix this permanently is a vaccination. Well, if you go on the internet and listen to people talk, how many people right now are talking about, I won't get vaccinated because it was made by Bill Gates and I'm going to get a rice chip put in me so the government can track me? You're not winning. You're not ever winning. Honestly, you're not ever winning. There comes a point where a decision has to be made for the better good of the public, and sometimes you have to make that decision because you have the best information and the public doesn't. Because as far as I'm aware, no one sits down with Dr. Nemerson or St. Luke's chief of staff or any of those folks and says, hey, you know what, I'm just a concerned citizen. I want to help my people. What's the smartest thing for me to do? Because they would get the same information we get. But we're getting this level of information that there is no permanent solution to this permanent problem. And so I don't know how we're supposed to go forward with an intelligent and well thought out decision, regardless of what that response looks like, for a permanent solution to a permanent problem when there is no permanent solution to this problem. And people have proven that they don't care what any of us say. I've got 25 emails in my inbox that say it straight to my face. They don't care what I say. They just want me to vote no. They don't care about anything else. They want to take the risk. They want to roll the dice. I just got an email 5 seconds ago from someone who's listening to this meeting, literally told me, I don't care if you're 70 or older, stay inside. I want to roll the dice. That is a dangerous way. And when you're in a situation, if it was cancer or AIDS or syphilis or something like that, and you were getting the same response, I think Dr. Epperly can agree because he's seen the repercussions of those diseases. People would be like, no, I'm starting a whole entire movement. We're going to, we're going to burn our clothes to save cancer, and I'm going to stay inside. But when you have a sickness that causes you to drown in your own, mucus, people are willing to roll the dice on that. And I don't know how you answer that. I really don't. It's really frustrating to me that that there are folks out there that are so vehemently scared to, for example, put on a face covering. No one had this issue when they put on a seatbelt. No one had this issue when we made us put airbags in our cars and didn't ask anybody. And I'm not saying that this is a permanent thing, because I don't, like I've talked to Diane about this. I don't want to wear a face mask for the rest of my life either. It bothers me. But at the same time, we need to come up with a solid answer. And I do agree, Megan, that we need to come up with a permanent solution. I just don't think we're there yet. And in the meantime, I don't know that we can afford to sit back and see what happens. And I just don't know that that's the right answer. And I'll stop.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
We're in the midst of a crisis. Long-term solution is wonderful for the future, but we're dealing practically and pragmatically with the present. When you have a patient that's bleeding to death, you have to stop the bleeding. The way to stop the bleeding right now, the most effectively we can, is to put people in face masks. If they choose to do it or not, that's their call. But I believe that we will start to see more and more and more compliance in Ada County and across the state of Idaho, because people are going to start to get more and more sick. We've already started to see the deaths, the young nurse practitioner in Caldwell, a tragic case. We're all going to start to see people we know, people we love have this. It's going to start to self-correct when people start to recognize this is real. And so I think the way we approach this right now is to do and control the things we can. The first is to put people in face masks. Yes, we can't go out and enforce every infraction, nor probably should we. It's not our job. Our job is to make the call on what we do to try to help with the problem. And there are three things. Number one, we put people in masks. Number two, we require 6 feet social distancing at a minimum. Number three, we control group sizes, which we already have, with lessening people to gatherings less than 50. And number four, we mandate and encourage and educate to hand washing. All of these things are educational strategies going forward. They need to be done. But at this moment in time, we have collectively a community that's starting to bleed to death. We need to go ahead and stop that, and we do so by face masking. It's the most important thing we can do. It will reduce the spread of this by 85% or more, and I think we need to act on that now.
Thank you, Ted. Other thoughts?
Madam Chair, this is Jane.
Yes, Jane, go ahead.
The other piece of that is, at least from where I'm coming from as a small business owner, is that we're not going to economically start to see any benefit until we do flatten out the curve and stop the spread. So I feel very strongly from the health standpoint as well as from the economic end of it that we take a stand now. And I think people, as they see it in their faces and it becomes people that they know and they're connected to, it's going to turn around. And I really appreciate Diana for all the educational piece that you're already doing. I didn't realize all of that was going on.
Thank you, Jane.
Madam Chair, this is El.
Yes, Elle, go ahead.
It's so interesting to hear everybody's point of view on this. I think Dr. Epperly's kind of right in the fact that we need to, I hate to say this, but we're going to have more distress and more death and more illness in some of these families for people to understand that, you know, why is it so hard for me to wear a mask? They need to ask themselves that question. You know, the other thing that like Jane said, is if we continue down this road, we're going to go back to stage 2 and back to stage 1 and non-essential travel, and businesses will be closed, and on it goes. And so do you want that, or do you want to try and get ahead of the curve now? The best education, as far as I'm concerned, is when somebody in your family has been sick. And we've been through that with some relatives of ours. And it's pretty scary, and they're young people and they've survived and they got through it. But it changes your attitude on it when you know somebody that has gotten it, or somebody has died from it, or somebody that has exposed you, and now you have to worry about yourself. Unfortunately, some people need a hammer to learn. It's going to take a hammer. So I think we should go ahead with the mandatory mask in Ada County and see how that works. And if we don't get a change in 2 weeks to 4 weeks, then we may have to maybe recommend going back to stage 2 or even stage 1 and start over, because that's what you do. Just my thoughts.
Thank you.
Thank you, Elle.
Betty Ann, this is Ted Epperly. I'm prepared to make a motion if you think it's time for this.
It sounds like there's no further discussion. So.
Madam Chairwoman, just can I one last comment?
Blank spot. Go ahead.
Okay, I just want to be clear that whether you decide to implement this order or not, I would really like to see something that was brought that was a little bit more cohesive of plan of what we need to do going forward. The place an order in Ada County and then wait to see what happens in Elmore County, I don't know that I'm a huge fan of. I'd like to be a little bit more proactive if we at all can. So I just want to make sure that that's understood.
Thank you, Megan.
So, Madam Chair, this is Ted Epperly. Are you ready?
Go ahead.
Okay. The motion I would like to make is in the vein of controlling the things that we can control and that people can control. We're not going to be able to control making a vaccine. We're not going to be able to control having antiviral therapy for this. What we're going to be able to control is face coverings, social distancing, and hand washing. So the motion I would like to make is that in addition to the existing order that now is in effect, that Central District Health has on the books, that we now require every person to wear a face covering in Ada County that completely covers the person's nose and mouth when the person is in a public place and others are present and physical distancing of 6 feet cannot be maintained. I'm specifically limiting this at this time to Ada County. It's where our major outbreak is. We can't control at this point what happens in Southwest District Health. I'm not sure at this point that we necessarily need to extend this to the other 3 counties, although I'm certainly open to that. But I think that the face masking needs to be targeted now at this point to Ada County. We must get on top of the outbreak here. We're at high water marks for the state at over 500 a day. We're at high water marks in Ada County of over 300 cases a day and growing. We're starting to see not only the hospitals get overrun with infection, but deaths starting to happen. This will continue. So the motion at this point is to make it mandatory for people to wear a face covering in Ada County that completely covers the person's nose and mouth when the person is in a public place and others are present and physical distancing of 6 feet cannot be maintained. And I'll stop.
I'm prepared to second that motion. This is Diana Laciondo.
Okay, the motion has been made and seconded. Is there any further discussion before I take a roll call vote?
Madam Chair, this is El.
Yes, El, go ahead.
I'm in full support of this motion, but I do think that Megan's got a great point in the fact that we need to PR really what's happening just in Idaho, and maybe even in our district. That people don't know that there's 350 new cases a day. People don't know that people are dying from this. We don't see that data, and so especially the younger middle-aged generation, they think, that they're going to get it, they're going to get over it, and they're going to be fine. And things like what Dr. Nemerson was talking about, 30% of asymptomatic people don't even know they have the virus, and they're out spreading it. Those are the kind of educational things, and they're facts, to get those out to the public. I really think that the public is getting misled on a lot of different volumes of data coming from YouTube and on the web, and a lot of people doing their own search, and we need to explain what is exactly happening here in our district so that people understand that it's closer than they think.
Thank you, El. Any further input? Hearing none, I will take a roll call vote on the motion, starting with Boise County.
Commissioner Sturm, aye.
Ada County, Jane Young.
Jane Young, aye.
Ted Epperly.
Ted Epperly, aye.
Commissioner Laciondo.
Diana Laciondo, aye.
Elmore County, Representative Blanksma.
Megan Blanksma, no.
Okay. The motion has passed, and we will go ahead and implement those orders as our staff can. That is the last agenda item we have for today, other than adjournment.
Madam Chair?
Yes, El.
You didn't ask for my vote, and I would like it to go on record that I have voted in support of this as well.
Did I miss you?
Yeah, you've missed me twice today, and I miss you too.
Well, we've been missing you for a couple weeks, but thank you. I apologize.
That's all right, but I just want to make sure my vote gets on the record.
Right. Okay. Thank you, El.
Madam Chair, this is Russ.
Yes, Russ.
Just a real quick question based on the motion and then what you had just stated. My assumption is the preference is to do this effective immediately. We had posted the draft orders on our website for the public to see. My intentions based on Dr. Epperly's motion and Diana's second is to make those effective immediately. So I was going to process that right now, sign them and publish them after the meeting ends. Is that acceptable to the board?
Yes, Russ, that was the intent, immediately.
That's fine.
Thank you.
Okay. I think we have covered our agenda today, so I will call for a motion to adjourn our meeting.
So
Madam
moved.
Chair, I'll make that motion.
Okay, thank you, El. I'll ask for a second.
I'll second.
This is
Diana.
Jane, second.
Okay, thank you. In hearing no further discussion, I will call for a roll call vote, starting with Boise County.
Commissioner Sturm, aye.
Ada County, Jane Young.
Jane Young, aye.
Ted Epperly.
Ted Epperly, aye.
Commissioner Laciondo.
Diana Laciondo, aye.
Valley County.
Mr. Hasbrook, aye.
Elmore County.
Megan Blanksma, aye.
Okay, thank you so much for your time and input, folks. And our next scheduled meeting is Tuesday, the 21st at 4 o'clock again. So thank you and have a good evening. Goodbye.
You too. Aye.
Stay well all.
Bye.